Madam Secretary, welcome to Planet America.
Thank you.
You know the reach and the power of this office as head of HHS. What could Robert F. Kennedy Jr. do if he is allowed to, as President-elect Trump says, go wild in the role?
Well, I think for your listeners, the Department of Health and Human Services is one of the largest domestic departments in the United States. About $1.9 trillion budget, over 85,000 employees, both in the US and across the globe. So it has an enormous reach. It has 11 operating agencies, the Food and Drug Administration, National Institutes on Health, runs the big government insurance programs of Medicare, Medicaid, and the marketplaces. We do work with children and families, mental health services, disability services. So it's a very important agency to Americans, really birth to death, and has a lot of influence and collaboration with colleagues all over the world. So as secretary, I think the first thing that makes me fear that Bobby Kennedy is unqualified for this position and potentially quite dangerous for this position is his views on vaccines. Most scientists feel that scientific advancement in vaccines over the last 100 years is one of the most amazing breakthroughs that we have and has almost eradicated diseases that used to cripple countries. Polio and measles come to mind. Bobby Kennedy raises all kinds of issues that have been thoroughly debunked by scientific review about vaccines tied to autism, vaccines causing other illnesses. And what that does is, from the bully pulpit of the secretary's office, is cast doubt, is raise concerns among parents who are trying to be good parents. They feel like somebody carrying the title of Secretary of Health and Human Services in the United States should actually know something about health and human services and follow his advice about not vaccinating their kids or not taking the appropriate precautions. And that puts all of us at risk.
So he's spoken about his megaphone there, but in terms of what he could actually do, my understanding is that the National Vaccine Program Office monitored vaccine safety quite stringently while you were around, and then the Trump administration stopped that. So if RFK brought that back, would that bother you?
It wouldn't bother me at all. I mean, as you say, we followed those guidelines. I think if we have a new vaccine, as we did with COVID, tracking it real time, making sure that if any red flags arise as people are being vaccinated, that you call attention to it, look at it very closely, and potentially even pull it off the market. We had a big vaccine campaign in the United States when Gerald Ford was president, and it was found that people began getting Guillain-Barré syndrome from the vaccine. The vaccine was quickly pulled off the market. So if there's an emergency, having a vaccine that has been tested is important, but also making sure that you continue to test and look at cases and take action swiftly with any new medication program.
So, Madam Secretary, it sounds from what you're saying that the issue here isn't that Kennedy is always wrong, but that he lacks the judgment to know when he is raising sensible health and safety concerns and when they're simply not sensible.
Well, I think that's a fair statement. Certainly some of his views on the United States getting tougher on food ingredients and going after our corporate interests who are overly influencing what people are eating. And so they are helping our population become more and more obese. Those kinds of issues, I think, are really important. A lot of what he's talking about, though, doesn't even rest within the jurisdiction of Health and Human Services. He says he wants to redo food stamps. That's in the Department of Agriculture. Take a new look at some of the processed foods. Again, the Department of Agriculture has a lot to do with that. So part of my concern is he really doesn't know or understand the agency that he has been nominated to lead, but also he is coming into that agency not with a question of who can I meet with? What do you do? How well do you do it? Learning about the assets. He has predetermined conclusions, many of which are absolutely proven wrong over and over and over again. And yet he clings to theories which have been thoroughly debunked. That's pretty dangerous with someone who talks about firing 600 researchers from NIH on day one. Why? And what is it that they're doing that he finds offense with? Does he even know what they're doing? So some of his statements cause great alarm because he's convinced he knows what's best. He is not willing to look at alternative evidence. He's certainly not willing to follow the science. And every once in a while, he might agree with a number of people on an issue, but some of his views are potentially quite damaging and potentially life-threatening for infants and children in this country.
Okay, let's talk about one of his pre-conclusions then. RFK says that the Center for Food Safety and Applied Nutrition at the FDA is not doing its job. They're not adequately protecting children, he says. Is he right?
Again, I wish he would meet some of the people and see the work they're doing. I would tell you, if the Center for Nutrition and Food Safety had total jurisdiction in that area, we would have a very different set of standards for food in this country. That isn't how those rules and regs work. All of the school lunch decisions are made out of the Department of Agriculture. The food stamp program is made out of the Department of Agriculture, not at HHS. We had major battles when I served as secretary inside the government about whether or not we would limit salt, limit sugar in processed foods, the way many European countries, and I think Australia, New Zealand, and others have taken dramatic steps that the US hasn't taken. That viewpoint of public health always came from FDA and the nutrition department. It did not necessarily come from other departments. And ultimately, the president made the decision not to be as aggressive as some other nations on that. So I'm sort of frustrated that he has cast all sorts of blame in areas where people really don't have the jurisdiction to make the decision.
Secretary Sebelius, we know that Donald Trump is the McDonald's-loving president. We saw that photo this week of Robert F. Kennedy Jr. sitting down with a burger and soda in front of him, but he counts the days that he hasn't had a soft drink, just as he counts the days of drug and alcohol sobriety. How can this partnership possibly work?
Well, it's hard to tell. I have stopped trying to predict what President Trump may or may not be thinking on any level. What we know in his first term is he had almost no health policy. He wanted to get rid of the Affordable Care Act and tried desperately to do it. He had a majority in the House, majority in the Senate, and he was president. He failed to do that because Republican senators wouldn't go along with him. And his other major health accomplishment was actually to stand up a remarkable vaccination program with Operation Warp Speed, a public-private partnership to, accelerate research into the area, manufacture a safe and effective vaccine, distribute it not only throughout the United States, but throughout the world. So it strikes me as very ironic that the guy he picks to be his new secretary is an anti-vaxxer. That is something that he knows something about, he worked on. His administration takes great pride in that being an accomplishment. If Bobby Kennedy had been there at the time, my guess is we'd still be looking for a COVID vaccine.
Now, Madam Secretary, RFK said that he wants the National Institutes of Health to focus for the next 8 years on researching cures for chronic disease, because he says that's what's killing Americans. What's your view on that?
Well, there are lots of things killing Americans. No doubt obesity and obesity-related diseases is a significant health crisis in the United States, and it's getting worse and not better. So that's an accurate view. Unfortunately, he doesn't get to pick and choose when we pay attention to infectious diseases. And in fact, if you look at the news across the United States, we have outbreaks of avian flu for which there is no cure currently, for which there is no vaccine. It has already moved from poultry population to farm animals and now to farm workers. And it's just a matter of time. And I can guarantee you it's not 8 years before we have some major outbreak. So my concern is I hope we're doing research on that potential vaccine right now. The National Institutes of Health has ongoing work on chronic disease, ongoing work on cancer, ongoing work on mental health, on addiction and recovery, and on obesity and chronic illness all at the same time. That's why they're different institutes and different scientists. I don't know which 600 he wants to fire, but I would hope that he doesn't get rid of any of them.
Madam Secretary, it seems that some Conservatives are not so concerned about Kennedy's vaccine scepticism, but they certainly don't like the fact that he is pro-choice on abortion. If confirmed as HHS Secretary, would Kennedy have any impact on the reproductive rights of American women?
It's hard to tell. As governor, I got to make my own policy decisions and, ran a number of divisions like a cabinet secretary does. As a cabinet secretary, you actually answer to the president. So the policies followed in the Department of Health and Human Services and across government are going to be policies promoted, approved of, and endorsed by President Donald Trump. Donald Trump takes great pride in being the president who appointed 3 Supreme Court justices and ended up ending the 50 years of protection of women's reproductive health rights. What else he will do in that area or wants to do in that area, I don't know. I do know there are lots of Republicans who would like to go after medication abortions, which are approved through the apparatus of the FDA. There are lots of programs within HHS dealing with contraception services and women's health care. There are programs that provide aid and assistance to folks. So I really can't imagine what exactly he wants to do. I can't imagine also that Bobby Kennedy and Donald Trump have ever had a conversation about women's health because it probably didn't come up.
I'm interested in your observations that RFK doesn't really understand how the HHS actually works. Are there any of the problems that he's identified involving, say, corporate culture, pesticides, food additives, that as HHS Secretary he could actually make real change in? Or is he just going for the wrong job here?
Well, I think that one of the great powers of any cabinet secretary is the opportunity to get a headline and a TV camera and an audience in any place in this country on any issue in this country. So just talking about issues and problems, he can have a lot of influence. He can, help to mobilize advocates. He can, without changing any rules or regulations or having any actual jurisdiction. So can he talk about obesity and chronic illness and tie it to food and identify areas where we could make great progress? You bet. Will that run into resistance from the Trump administration, from people who are very closely tied to either the ag industry or food manufacturers? You bet. And so I don't know how that clash is resolved, how he maintains a viewpoint that could be directly countered to a number of the president's close friends and allies, but I guess we'll find out if he's ever confirmed for this position. Some of the specific programs that he talks about wanting to influence are not within HHS, so there's very little he can do but do what he's doing now, which is to talk about them.
You, of course, played a very important role in the implementation of the Affordable Care Act, so-called Obamacare. Does the re-election of Donald Trump pose an existential threat to those healthcare reforms, or after more than a decade now, has that been bedded in and become a permanent part of the American health system?
I've long since stopped trying to speculate what they may or may not want to do. I think it's very difficult for me to imagine the majority of members of the United States House and the United States Senate voting to repeal a law which is now relied on by their constituents and has been, as you say, in place, really fully implemented since 2014. So we're now at a decade. The law was passed in 2010, but full benefits are there. What they can do, though, without repeal is a lot of damage. And Donald Trump found that out the first time of, cutting off resources, making it much more difficult to enroll people, discouraging providers from participating. I mean, there are a series of actions you can take from within the agency to weaken and help to debilitate the law. But my belief is it's now firmly ingrained. About 50 million Americans have used the law to obtain health insurance for themselves and their families over the last 10 years. That's a very difficult benefit to eliminate and take away without causing huge havoc throughout the population.
Secretary Kathleen Sebelius, thank you for being with us on Planet America.
Thank you.